Worldwide, about 10% of pregnant women and 13% of women who have just given birth experience a mental disorder, primarily depression. In developing countries, this is even higher, that is nearly 16% during pregnancy and nearly 20% after childbirth. The reality is few seek help as there is poor awareness of signs of mental depression. "32-year-old Sabha, who's from Puducherry, recalls always wanting children. 6 years ago, when she got pregnant with her first child, Sabha looked forward to the delivery. Months later, her son was born. Her circle of happiness should have been complete, except that Sabha was experiencing a very disturbing reality.
I was very silent and gloomy, and I was not happy at all, and I used to sit sad, and mainly the thoughts were disturbing me. The thoughts were coming like I want to harm my baby and throw the baby. I can't even tolerate the sound of my baby, and it was very, very hard for me to struggle with those thoughts. After 14th day of delivery, the symptoms were like the thoughts were coming into my mind like I want to kill my child and I don't want to take care of him, and I was very scared of why it is coming.
Her baby was barely a month old when one day Sabha, unable to deal with his crying, threw him from her lap. Though her baby was unhurt, her family was shocked by the incident. They sought counselling and were referred to the National Institute of Mental Health and Neurosciences or NIMHANS in Bangalore.
Sabha was diagnosed with a severe form of postpartum depression, symptoms of which are usually seen after delivery. But thousands of women suffer from depression even during their pregnancies, which is the antenatal phase, and this is known as perinatal depression.
Mothers like Sabha are ready to undergo another childbirth. 5 years after her first child was born and 5 years after she received treatment for depression, Sabha became pregnant with her second child. She was in constant touch with her doctors. Though there was no problem during pregnancy, after delivery she suffered from an episode of depression.
In her second pregnancy, we looked after her throughout. But in the postpartum period, when the baby was very small, lovely baby, she started getting very negative thoughts about the baby. We admitted her for a bit, restarted her on medication, and she's again, doing very well. So the good thing was that she herself identified what was going wrong, and the husband was very supportive.
I would expect that anywhere from 5 to 10% of all mothers would experience an episode of depressive or anxiety disorder during their pregnancy or in the 12 months after their baby is born. However, they don't all suffer to the same extent. So I think it's also important to distinguish degrees of severity. There are some mothers who would be extremely depressed, and I would say out of every 100 mothers who have a depressive episode, about 20 of those mothers would be very severely depressed. That is to say that they might need psychiatric interventions.
Nandita, an IT professional from Bangalore, had an active social life before she became pregnant. After her baby was born, she went to her parents' home in Mangalore. As was the custom, she had to spend the first 40 days indoors as it helps to prevent the baby from contracting infection when its immunity is low. But it also restricts the mother's movements as interaction with others is discouraged. Instead of feeling rested and comforted, Nandita began to feel isolated. She soon realized she had begun to hallucinate.
I was not supposed to go out of the house. I was only with the baby all the time, and totally everything is revolving around the baby. So that's when it got worse. I didn't really share it initially, and I kept it as a secret. Eventually what happened was sort of what blues I had, they turned little severe. I used to get sort of visuals of the baby being dead, or some sort of hallucinations about me dropping the baby, harming the baby. So all this made me feel like really guilty, and I just used to feel that, I'm a bad mother.
This confinement for a person who is having an active life is basically the triggering factor in the case of a urban woman. And in the case of a small town girl, though she is maybe she is not working, but the pressures at home are much more in that case. There are certain there are certain religious attachments to postpartum period, as if she's she's dealt as if she's an untouchable. In that case, she just has to stay with her child in a room. I've had patients who've not come out of the room for 40 days. They're given food inside and they're made to stay there, and they don't have any contact with their husbands. They can't talk to anybody. That kind of rigorous imprisonment, I would say, is also there in small towns, especially in the south.
Nandita searched the internet for answers and quite by chance learned about postpartum depression. She reached out for professional help as she became aware that her condition could have an adverse effect on her baby. As Nandita was to find out, biological, psychological and social factors contribute to maternal depression.
The biological depression is that there is significant hormonal change. The pituitary neuroendocrine axis is affected. The estrogen and progesterone, sudden changes happen in that. Cholesterol is increased, thyroid becomes low. All these can contribute to depression. You could always have a serotonergic imbalance in your brain. There's a neurochemical called serotonin which might become low. These are the chemical influences that might happen. The psychological influences, you are supposed to be a caregiver, you are supposed to be happy. You might be blaming yourself. You might also be having negative thoughts about your capacities, about your child, about the future.
There is no single trigger for perinatal or postpartum depression.
So triggers could be unplanned pregnancy, relationship with the spouse which is not fine, spouse who is into alcohol or drug abuse, any kind of physical or emotional pressure or torture of any kind, that will have a very, very bad impact. There is enough evidence to suggest that unplanned pregnancy statistically makes you more vulnerable into having more postpartum blues.
According to a study on postpartum psychiatric care by Dr. Prabha Chandra of NIMHANS, gender-based factors emerged as being highly important, with intimate partner violence, unhappiness about the gender of the child, poverty being identified as risk factors, both for the occurrence of postpartum depression and for chronicity. The symptoms can be mild, like anxiety, crying spells, mood swings, lack of sleep. Others have difficulties in bonding with the baby, negative thoughts and hallucinations. In the absence of proper counseling and support, some get worse, developing postpartum psychosis.
15 out of 100 women will have some, significant mental health problem, either depression or very severe anxiety. So if you calculate it with the number of women who are available and who are there in India, you know that the magnitude is really huge.
Women suffering from postpartum psychosis, which is a severe mental illness, have caused harm to themselves or their babies. In October last year, the Bangalore police found the body of a 7-month-old baby girl in a water dump. Her mother later confessed to killing her. She was suffering from postpartum depression. In September 2010, a mother drowned her 8-month-old baby boy in a washing machine at her home in Alappuzha, Kerala. She was under treatment for postpartum depression psychosis. According to the National Crime Records Bureau, over 20,000 young mothers, mainly housewives, kill themselves every year.
I think it is an important question. Why are female suicide rates in youth in India so high? Actually 6 to 7 times higher than, for example, comparable age groups in Western Europe. One of the reasons for this could be mental health problems, but I believe that there's also a larger social context in which one has to understand suicide in young people. And in the case of women's lives, of course, gender disadvantage has to be seen as a very important driver.
Sunita from Sehor district in Madhya Pradesh became pregnant for the 3rd time She was obsessed with the desire to have a boy.
मैंने पूछा क्यों इस कारण से, मतलब क्या कारण है, क्यों रहता है ऐसा आपको? कहने लगे मुझे थर्ड बच्चा है, 2 बच्चे मेरे जो हैं, मेरे पास बेटियां हैं, तो मुझे मन में बस सिर्फ ये घबराहट रहती है कि ऐसा नहीं हो तीसरा भी मेरे बेटी हो जाए। तो अंदर जब ये बातें सोचती रहती हूँ तो मुझे अपने आप को अच्छा नहीं लगता, ऐसी कमज़ोरी सी महसूस होती रहती है।
Sunita was diagnosed with perinatal depression. She went into early labor and lost the baby during delivery.
हाँ, सोचने को तो सोचते थे कि अगर लड़का हो जाए तो ऑपरेशन करवा दें, 2 लड़कियां भी तो है, तो एक लड़का हो जाता तो ऑपरेशन करवा देते, पर अब फिर लड़की हुई और वो भी मतलब पेट में ही गुजर गई थी।
Unlike thousands of women in rural India who go undiagnosed and battle depression without support, Sunita received treatment under the newly launched Prime project in Sehore. The Prime project, designed by Professor Vikram Patel and his team, integrates mental health care with primary health care. The project has trained community health workers to recognize signs of mental illness and depression. After the success of the Sehore pilot, the project was scaled up with the help of the Public Health Foundation of India. The project has trained 1 medical officer and 2 nurses in each district of Madhya Pradesh to help women cope with depression. The trained staff sensitizes doctors who conduct antenatal checkups so that they are able to identify women who show signs of depression. These women are referred to the medical officer for counseling. Ashas or health workers who make home visits are also involved in providing regular updates about their progress. Madhya Pradesh is the only state to have a program to tackle mental depression on this scale.
The good part about the public health system in India is that many women do visit antenatal clinics. So in our program, what we do is that we contact potential mothers during their antenatal visits in the facility itself. We screen them for depression, and if we find them to be positive for depression, we kind of initiate psychosocial interventions.
Many challenges remain in addressing this problem. One of the major ones is the lack of trained, skilled health workers to screen women for depression. The entire mental health care workforce in India, comprising of trained doctors, psychologists and psychiatrists, is that of under 10,000 people. The requirement is 8 times that number.
When women are undiagnosed and untreated, postpartum depression can have a negative impact on the health of the newborn.
The babies of mothers who are depressed are more likely to be underweight and stunted. Indeed, it is estimated that about a quarter of the whole burden of underweight and stunting, which as you know is a major public health issue in India today, can be accounted for by maternal depression. And the second important finding is that the babies of mothers who are depressed have delayed cognitive, that is to say their brains are delayed in development, which means that these babies will struggle with achieving the kind of educational outcomes that other babies would have.
This mother and baby unit at Nimhans, Bangalore is the first in the country to address the issue of prenatal and postpartum depression.
ఆ సమయంలోనే ఇప్పుడు నేను ఎందుకు ఉండాలా, చచ్చిపోవాలా అని ఆలోచనలు వచ్చేదా? 2 సార్లు ప్రయత్నం చేసినారా? ఎవరైనా ఉన్నారు అప్పుడు ఇంట్లో ప్రయత్నం చేసినప్పుడు?
Mothers who are undergoing treatment can stay with their child in the ward. Apart from psychiatrists and nurses, the team includes psychologists and social workers. Members of the team work with the mother and help her bond with her baby. Patients who are diagnosed with psychosis need intensive care and monitoring. The treatment relies on counseling, cognitive therapy and medication. Postpartum depression is reversible and mothers are able to nurture and take care of their children. There is a need for greater awareness of the problem. Women who have faced postpartum depression believe the difficult part is to acknowledge the symptoms and seek help.
I think that kind of third person looking at the problem really helped, and they told me it's just the stigma attached to it makes it more worse. So don't feel bad about yourself, you don't need to feel guilty, it's perfectly normal. You have to be open about it, you need to go see a professional talk about it, discuss your problems and find out what's going on.
Gynecologists and family members who are in constant touch with women during antenatal and postpartum period have to be alert.
Every woman should be screened for postpartum depression. For the first, the first 6-week visit, the pediatrician, the gynecologist, the physician, everybody needs to be aware of postpartum depression. The family, the person themselves. There's a lot of psychoeducation that is required to ensure that people who have depression are not missed. Because postpartum depression is one of the most commonly missed diagnoses in psychiatry.
Women's mental health should be priority, because I think if you have a mentally healthy woman, not only the baby at that point, but the whole family's mental health is going to get better.
Supportive husband is very crucial today because families have shrunk. It's just the two of you and your baby, and so both of you need to support each other more than ever before.
Experts suggest that women who sense there is a cause for concern must share their feelings with their partners and family members. And if the symptoms persist for over 2 weeks, then family members must seek the advice of a medical professional.